Barbara Kraft. I am an Associate Professor of Medicine in the Division of Oncology at the University of Mississippi Medical Center. I also serve as the Principal Investigator at the University of Mississippi for SurviveMISS. Metastatic breast cancer means breast cancer that has spread beyond the breast and the regional lymph nodes. When breast cancer spreads, it typically goes to the axillary lymph node, the lymph nodes under the arm on the same side of the cancer. Once it has spread beyond that point to either other lymph nodes or other sites in the body, such as the lung or bones or liver, it is considered metastatic disease or stage 4 disease. About 20% of all patients at the time of initial diagnosis have metastatic disease. Another up to 30% of patients who had early stage disease can go on to develop stage 4 or metastatic breast cancer. Unfortunately, young patients are at increased risk. Once you have stage 4 breast cancer, it is treatable, but it is not curable. There are patients who we can get disease-free. Sometimes we can get rid of it on imaging, but it is never curable. Once a patient has been diagnosed with metastatic breast cancer, we start them on therapy and we scan them every 6 to 8 weeks, every 3 months to see how their disease is responding to treatment. When you have stage 4 disease, the treatment's a little different. Usually, treatment consists of systemic therapy, either with targeted therapy, endocrine therapy, or anti-HER2 therapy, drugs like tamoxifen or Herceptin, or it can be chemotherapy. A lot of women who come in with stage 4 or metastatic breast cancer have decreased appetite. They've lost a significant amount of weight when we see them, and oftentimes when we start treatment, they feel better, they feel like eating, they gain weight, they become more active, and they're able to do more of the things that they enjoy. Unfortunately, it's just the nature of cancer that it can come back. One of the places that breast cancer can come back is to the bones. And people hear that and they think, oh, I've got bone cancer and this is terrible. Fortunately, if you have breast cancer that just goes to the bones, the new standard is to start treating bone-predominant metastatic breast cancer with hormonal therapy. We do not just start with systemic chemotherapy. We usually try hormonal therapy or a targeted therapy first. We do have patients who do respond amazingly well to treatment, and we do have patients who even have extensive breast cancer that spread to lungs and liver who can get what we call a complete response. We get follow-up imaging and there is no disease that we can see. We can say that at that point they're disease-free and they have an improved survival, an improved prognosis. Sometimes these patients can even get what we call a treatment holiday. They can go off treatment temporarily. We know that there are certain things that put you at increased risk for developing breast cancer. And then once you've had breast cancer, there are certain things you can do to kind of decrease that risk. Eating a healthy diet and exercising, maintaining a healthy weight. We don't want our patients smoking. Once my patients have had a diagnosis of breast cancer, I ask them to avoid anything with estrogens in it, hormone replacement, oral contraceptives. Of course, we do have to weigh that with their quality of life, especially if a woman is perimenopausal or postmenopausal. Sometimes the hot flashes and vaginal dryness can cause a negative impact on their health. And so occasionally, to improve quality of life, we will tell them that they can take a small dose of estrogen for as short a time possible. The good news is with breast cancer, there's lots of available treatments. There are more being developed. There's lots of new drugs in the pipeline. There's lots more targeted therapy, which hopes to target that individual cancer with decreased side effects. There's a lot of research going on, so that's very encouraging.